Hi, my name is Chelsea Beyer, and my TED Talk today is on the importance of patient engagement. There's reasoning behind patient engagement. Much of that reason is the importance of it, obviously. While we understand that doctors and advanced practitioners are to do their jobs and care for patients, patients now are enduring the right to care for themselves outside the healthcare system as well. When patients learn to continue their own treatment in their homes, it creates a sense of stability and well-being for not only the patient but the healthcare provider as well. Ever since healthcare has been around and doctors had made house calls and hospitals were created to help care and treat people, there has always been a sense of responsibility for a patient to engage in the care of themselves. This is why it is so important to have and be able to measure patient engagement in today's busy society. The second thing that's very important about patient engagement is that it decreased healthcare costs. It also increases provider revenue. In order to decrease the healthcare costs, providers and patients are both responsible for patient engagement and the patient care outside of the hospital setting. Healthcare providers are required now more than ever to assist patients in their care at home, as reimbursements for their services pretty much rely on it. Also, keeping patients out of the inpatient setting can also decrease the cost of healthcare. Patients that are not being readmitted are of high priority, and it's also important for patient safety as well. Patients who feel they are cared for by their providers and feel a sense of comfort upon visiting them tend to be more apt to follow directions outside of a hospital setting. Also, patient satisfaction tends to equal more patient engagement. When finding ways to better serve patients, surveys seem to be a good route, as they provide accuracy on patients' understanding of their visits and ability to relate to the providers. When patients are satisfied with their care, this can help them care for themselves outside of the clinic setting also. This sets them up for an understanding by their provider. Being satisfied with their care and treatment of the patient by any medical staff can create a sense of trust between healthcare providers and the patients. Next, patient engagement causes knowledge, health, and wellness. When a patient is active in their disease treatment, like changing a bandage on a wound at home, or preventative measures such as overusing antibiotics, creates health and wellness for the patient, thus causing less admissions and visits to hospitals or in clinics. Having patient teaching is a large need by healthcare providers. If done properly, patients take home the information in which they have acquired and utilize it to keep their health at an optimal level. Patients being engaged in their care can not only prevent hospitalizations, but can also increase the knowledge of family members, as they are then taught how to care for those ill or injured inside the home. Also, when a patient engagement is followed up on, it is wonderful. Not just phone calls either, but being able to follow up on whether a patient is truly caring for themselves outside a hospital setting is a very difficult task. Yes, having surveys, it does help, but being able to be within a patient's home to do more teaching or more care for patients may be a better answer, and which can come from nurses. Insurance companies then, who tend to offer payment for home health services, they should also be able to offer post-treatment in a hospital setting reteaching options and quality of home care by the patient. So, in other words, if a patient is sent home after surgery and they're required to either go to physical therapy or whatever have you, it's always a good thing to be able to go inside the patient's home and follow up with them that way, because that's their comfort zone. That's where they're comfortable. Asking them questions when they're in a physical therapy session is not the same as asking them, questions when they're in their house, because you get to see their obstacles, you get to see what they deal with daily. And it's very important to be a part of that. Patients having follow-up visits in the home where they are most of the time can better increase their knowledge, as I had said, and understanding of their diagnosis and treatment, as well as equip not only the nurses but the providers with a better understanding of the patient's capacity to care for themselves or others. If reteaching another way is necessary, also that can be done as well. So in conclusion, patient engagement is extremely important. It is a big part of not only, like I said, reimbursement, but it is also a big part of patients caring for themselves. If we don't have patients caring for themselves and it's only left up to those providing healthcare to them, then healthcare will be extremely expensive in the coming years. So being able to have a system set up where we can go in and evaluate a patient's understanding of why they are the way they are, why they're there, what is important about them being where they're at, and how to help any problems that they have is a big deal. And it definitely needs to be followed up on. And I think more one-on-one time with patients inside of their home to see what they deal with on a daily basis is definitely going to be a bigger benefit to the healthcare system. Thank you.